2 members of that family were previous residents of Level 3 at the Holiday Inn at Tullamarine Airport and were primary contacts for that particular outbreak. One member of the household who was not at the Holiday Inn was considered a secondary contact and had been isolating with the other family members. All 3 had negative tests, multiple negative tests, between the 10th and the 12th of February. All have been quarantining at home during their infectious periods. The family took their day 11 test at a drive-through site close to their home yesterday and has, as a result, returned that negative test. Initial reports and interviews were underway last night, and those interviews have continued today. And again, we thank the family for, from all of those reports, being isolated throughout their entire infectious period and throughout the entire period that they have been quarantining at home. We've also got an update in regards to the vaccine rollout. We put out a statement a little while ago. We can confirm information regarding the rollout of the Commonwealth's COVID-19 vaccination program commencing Monday. From Monday, we will start vaccinating those Victorians who are most at risk of contracting the coronavirus and are at the front line of be it either border-facing or hospital and healthcare work facing risks from the COVID-19 pandemic. When it comes to the hotel quarantine workers, port of entry workers, frontline staff, these are the groups that are most likely to be at the forefront of that international facing risks, and they will be the ones in this first Commonwealth Phase 1A, as they are calling it. Whether it's the specialist workers at hotel quarantine in Victoria, at the airports, at the COVID specialist wards, the ICU wards, those kind of settings, we will see some significant number of Victorians at the sites start their COVID vaccinations as of Monday. We will also commence the public sector residential aged care testing, Victoria being the only state with a significant public sector residential aged care community, which the state will be doing those on behalf of that sector, whilst the Commonwealth will be responsible for the significantly larger private residential aged care sector. All of this work will commence from our hubs at the Austin Hospital, Barwon Health, Western Health and Monash Health Services. Monash Health will also work with Alfred Health around that initial rollout to those high risk, particularly hotel workers, given the important role that Alfred Health had been playing in infection prevention and control at particularly the health hotels. Much of this work will be conducted on site at the hubs, the Pfizer hubs at these locations, but not all of it. Some of it will take place at specialist outreach sites, such as Western Health, for instance, will be establishing a hub at Melbourne Airport, given the high numbers of workers in this at-risk group at the airport. All other of the remaining hospital hubs will be coming progressively online as the Commonwealth provides all of the states the increased numbers of the Pfizer vaccine that has been scheduled to arrive in coming weeks. Again, we have these settings in place ready to support the rollout. We want to thank the Commonwealth for the constructive partnership that they have shown in delivering their program. All of the Victorian health services that we had previously announced are ready. We are there, ready to go when the Commonwealth provide the vaccine. As new supplies are further approved, we've already had obviously The AstraZeneca program, the AstraZeneca vaccine approved this week. Novavax and others will presumably come online as the announced schedule of the rollout, the biggest single logistical exercise in Australia's medical history and arguably of any program. As the Prime Minister has indicated, the program is scheduled to start next week and run through to the end of October in a series of phases. Phase 1A commences next week, runs into March. Phase 1B is scheduled to commence later in March, and the Victorian Government is very keen and ready, willing and able to assist the Commonwealth in this really important turning point in how we as a country, we as a community respond to this pandemic. As the Chief Health Officer has indicated, this is a very important milestone, arguably the beginning of the end of the pandemic, but that does not mitigate the need for us to continue all of the measures that we have in place, the social distancing, the mask wearing, the hand sanitising. All of these really important measures will continue to be important for some time yet, a substantial period of time. But the vaccination program is clearly an important milestone and one we welcome.